Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is a classification number 31, drugs used in the treatment of tuberculosis and leprosy, anti-tubercular drugs and anti-leprosy drugs. This classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 30 classification videos. If anybody has not seen previous videos, please go in the channel's playlist and watch all the previous classification videos, because these videos are very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. Believe me, a lot of MCQs they are going to be covered just by watching these classification videos, because in these videos I have not only explained you about the classification but also other important points which are very important for your GPAT and other exams. So please watch all the videos on the class. My dear students, before starting the classification of anti-tubercular drugs, you should know what do you mean by tuberculosis. Each and everything cannot be covered in this video, but I will try to cover whatever I can. So what do you mean by tuberculosis? Tuberculosis क्या होता है? Tuberculosis is a kind of infectious disease. It is caused by infection of acid-fast bacilli known as a Mycobacterium tuberculosis and Mycobacterium bovis. So जो acid-fast bacteria होता है, Mycobacterium tuberculosis, Mycobacterium bovis, it causes the infection of your cells known as a tuberculosis or simply TB. Now these bacteria most of the times they infect the lungs cells. Cells present in the lungs develop a fibrous tissue in the lungs, fibrosis, and also causes the infection of other cells present in your body. So tuberculosis infection लंग्स के सेल को प्राइमरीली अफेक्ट करता है और बाकी सेल्स को भी अफेक्ट कर सकता है, जैसे आपका डब्ल्यूबीसीज हो गया या फिर बाकी बॉडीज के सेल्स के. मोस्ट ऑफ द ड्रग्स दे आर रेजिस्टेंट टू ट्यूबरकुलोसिस एंड ट्यूबरकुलर बैसिलाई easily get developed resistant to this drug. So that's why you have to use this drug cautiously. And drugs used in the tuberculosis, they are classified into two types. First one is nothing but the first line drug. First line drugs. So first line drugs means what? They are highly efficacious drug or they are highly effective drug and they are low adverse effect. So जो first line drugs होता है उनमें effectiveness ज़्यादा होता है और adverse effect कम होता है. So what are these first line drugs? They are nothing but the isoniazid, rifampicin, pyrazinamide, ethambutol and streptomycin. So how to remember these drugs? So there is one trick. यहाँ पे याद कैसे रखना एक ट्रिक होता है, जैसे इश्क प्यार से कुछ नहीं होता, रोटी कमाने के लिए रुपीस कमाना पड़ता है. इश्क मतलब क्या? इश्क का आई फॉर आइसोनियाजाइड, ठीक है, प्यार फॉर पायराजिनामाइड, से यस फॉर स्ट्रेप्टोमाइसिन, ई फॉर इथाम्बुटोल. ओके, इश्क प्यार से कुछ नहीं होता, रोटी फॉर रिफाम्पिसिन, रोटी कमाने के लिए रुपीस कमाना पड़ता है. सो यू कैन रिमेंबर फर्स्ट लाइन ड्रग बाय जस्ट यूजिंग दिस ट्रिक. इश्क प्यार से कुछ नहीं होता, रोटी कमाने के लिए रुपीस कमाना पड़ता है. दिस वाज द फर्स्ट लाइन ड्रग. सेकंड लाइन ड्रग्स, इन दैट यू हैव थ्री कैटेगरीज: फ्लोरोक्विनोन्स, अदर ओरल ड्रग्स एंड इंजेक्टेबल ड्रग्स. सो फर्स्ट वन इज द फ्लोरोक्विनोन्स, इन दैट यू हैव ofloxacin, levofloxacin, moxifloxacin and ciprofloxacin. So how to remember this? There is one trick again. CM on lev. CM मतलब chip nester is on lev. C for ciprofloxacin, M for moxifloxacin, O for oxafloxacin and L for levofloxacin. So CM on lev. तो CM क्या है? छुट्टी पे. CM क्या है? छुट्टी पे. CM is on lev. C for cipro, M for moxi, O for oxafloxacin and levo for levofloxacin. So देखो यहाँ पे CM on lev. Now second class, in the second line drug you have ethionamide, proethionamide, cycloserine, terizirone, para-aminosalicylate acid, rifabutin and thiazolone. So you can remember these drugs: ethionamide, proethionamide, cycloserine, terizirone, para-aminosalicylate acid and rifabutin and thiazolone by using one trick. मैं आपको जो पढ़ रहा हूँ वो कहाँ से पढ़ रहा हूँ? पीपीटी से. पीपीटी, पी फॉर प्रोइथेनामाइड, पी फॉर पैरामाइनोसैलिसिलिक एसिड, टी फॉर टेरिजिडोन. सो पीपीटी से क्या होगा? पीपीटी से पढ़ रहा हूँ. पीपीटी मतलब पी फॉर प्रोइथेनामाइड, पी फॉर पैरामाइनोसैलिसिलिक एसिड, टी फॉर टेरिजिडोन, PPT CE मतलब से, C फॉर साइक्लोसेरिन, E फॉर इथेनोमाइड। सो PPT से क्या मिलता है? TRP मिलता है। PPT से मिलता है आपका TRP। सो PPT से TRP, R मतलब रिपब्लिटिन एंड T मतलब थायस्टेरोन। सो PPT से TRP मिलेगा। यू कैन रिमेंबर दिस other oral drugs by one trick known as PPT से क्या मिलेगा? TRP. So P for paramonosalicylic acid, P for proethanamide, T for terizidone, then say C for cycloserine and P for E for ethanamide and TRP. So R for ribavirin and T for thiazidone. You can remember this by one trick known as a PPT से क्या मिलता है? TRP. PPT से TRP. In the second line drug, injectable drug, kanamycin, amikacin and capreomycin. So kanamycin, amikacin and capreomycin, these are aminoglycosides. They are used injectably. They are having highly effectiveness and less toxicity. Second line drug, they are less effective and more toxicity. तो सेकंड लाइन ड्रग होते हैं जिनको टॉक्सिक ज्यादा है। अब फर्स्ट ड्रग क्या है? फर्स्ट लाइन में आइसोनियाजाइड। सो आइसोनियाजाइड इज आइसोनिकोटिनिक एसिड हाइड्राजाइड। सो इट इज अ कंपाउंड related to nicotinic acid. So isonicotinic acid hydrazide. Well, this is a first line drug, effective inside the cell as well as outside the cell, and this is the most effective drug. It is the most commonly drug used for prophylaxis of tuberculosis. Then इसका एक adverse effect होता है peripheral neuropathy. So it causes the peripheral neuropathy, and for that pyridoxine is used. Pyridoxine or vitamin B6 is used for the prevention of peripheral neuropathy caused by isoniazid. It also causes the optic neuropathy, hepatotoxicity. The second drug होता है आपका rifampin. So rifampin is nothing but it is a antibiotic related to rifamycin. In that you have another antibiotic like rifabutin and rifapentin. So it inhibit the RNA dependent DNA polymerase enzyme. Okay. It has a one adverse effect known as a orange coloration of urine. You have to remember. Third one is a pyrazinamide. Pyrazinamide is a drug related to isoniazide again. Mechanism is similar to isoniazide. Adverse effects are also similar to isoniazide. Hepatotoxicity, neuropathy, etc. etc. Ethambutol. It is again a first line drug. Ethambutol. It has an adverse effect known as a optic neuropathy. तो इसका एक major adverse effect होता है optic neuropathy. The patient is not able to discriminate between red and green. तो रेड ग्रीन कलर का डिस्टर्बेंस हो जाएगा ऑप्टिक न्यूरोपैथी caused by ethambutol. Then streptomycin, you know that is the aminoglycoside inhibit the protein synthesis. All the fluoroquinolones has one adverse effect, you know that is a tendon damage and cartilage damage and HLS. So again another adverse effect of fluoroquinolones, they have a phototoxicity. You have to remember phototoxicity. Right? Paramonosalicylic acid is a compound related to sulfonamides. It inhibit the formation of folic acid in the bacteria, right? Now kanamycin, amikacin, capreomycin, these are the other injectable drugs. You can remember ethambutol, isoniazid and rifampicin, they are effective inside the cell also. So they are effective in killing the tubercular bacteria in the tubercular cavity. Isoniazid, rifampicin, pyrazinamide, they are also effective in the removing the tubercular bacilli in the macrophages. So streptomycin, bactericidal bacilli in the blood. Now there is only one drug known as a rifampicin. एक ही ड्रग होता है rifampicin which is known as a active against the persister. persisters क्या होता है? जो tubercular bacilli है जब non favorable condition होता है, so it become a dormant and ये एक सेल में जाके बैठ जाता है. जैसे दिखाता है कि मर गया लेकिन dormant होता है. In the cell there is a fibrous layer synthesis, and due to that fibrosis blood supply will not be there, less blood supply will be there, and that's why that form is known as a persisters. So ये dormant form होता है और जब भी favorable condition आएगा ये फिर से regrowth होगा. So in that persister only the rifampicin is active. We'll see the classification again. Alternative classification for antitubercular drug. Group first line oral drug. In that you have isoniazid, rifampicin, pyrazinamide and ethambutol. Group second, in that you have injectable drugs streptomycin, kanamycin, amikacin, capreomycin. Group third, you have ofloxacin, levofloxacin, moxifloxacin, ciprofloxacin. 4, in that you have second line drug ethionamide, proethanamide, cycloserine, terizolone, paramonosalicylic acid. Now second line drugs, they easily get resistance to the bacteria, and that's why they are known as a reserve drug. Second line drug, they are known as a reserve drug. Now group or fifth class. So drug which efficacy has not been cleared. मतलब ये इनका effectiveness clear नहीं है अभी तक. So thiazidone, clarithromycin, clofazimide and linezolid. So यहाँ पे thiazolone will have a metallic taste in the mouth. Now clopidogrel is the most commonly used drug in the leprosy. Clopidogrel. Anti-leprosy drug मतलब leprosy is caused by one acidophilus bacilli known as a Mycobacterium leprae. Leprosy is also known as a Hansen's disease. आपको याद रखना है. Leprosy is also known as a Hansen's disease because it was first time described by Sir Hansen in 1921. So leprosy is known as a Hansen's disease. So leprosy will affect the mostly the skin. Leprosy is the Hansen's disease which affect your nerves, peripheral nerves and lymphatic tissue cause lymphoadenopathy. So in that different kind of drugs used. पहला होता है सल्फोन. Sulfone is nothing but the dimethyl diphenyl sulfone and sulfone is a drug related to sulfonamides. उसका mechanism भी same ही है. Is inhibit the synthesis of folic acid. Adults पे भी same ही है. Now phenazine derivative. Phenazine derivative is a clopidogrel. Clopidogrel is a dye known as a phenazine derivative. It inhibits the DNA synthesis of bacteria and it is the most effective drug in the leprosy. So clopidogrel causes coloration to the skin. ये red coloration करेगा. Clopidogrel is having adverse effect known as a red coloration to the skin. Then anti-tubercular drugs used in the leprosy, rifampicin and ethionamide. Other antibiotic used in the leprosy, ofloxacin, moxifloxacin, minocycline and clarithromycin. Okay, MMCO. Now we'll see the classification again. Classification of tubercular drug, anti-tubercular drug. So class 1 is known as the first line drugs. They are also known as the standard drugs. They are also known as a standard drug. They have high efficacy and low toxicity. So in that bactericidal मतलब बैक्टीरिया को किल करने वाला, isoniazid, rifampicin, streptomycin and pyrazinamide. Bacteriostatic मतलब बैक्टीरिया का ग्रोथ प्रिवेंट करने वाला, ethambutol and thiazolone. So remember thiazolone has a metallic taste in the mouth. That is adverse effect. Ethambutol has a optic neuropathy. Isoniazid has a peripheral neuropathy and hepatotoxicity. Rifampicin has a orange coloration of urine. Streptomycin has a neurotoxicity and hepatotoxicity. Plus second drug, they are known as second line agent. They are used as a reserve drug. They are known as a reserve drug. In that bactericidal, capreomycin, kanamycin, amikacin, fluoroquinolones, and in that bacteriostatic, ethionamide and cycloserine, clopidogrel. Class 3 drugs, they are known as a third line drug, clarithromycin, linezolid and clopidogrel. No single drug should be used in the tuberculosis. Single drug use नहीं करना है आपको क्योंकि वहाँ पे resistance जल्दी हो जाता है. Single drug should never be used in the tuberculosis as this lead to development. Exception is the isoniazid. Isoniazid can be used singly. Now diagnostic test for tuberculosis is the Montox test. इसके ऊपर क्वेश्चन आ चुका है. Montox test is the diagnostic test for tuberculosis. और ये क्लासिफिकेशन के ऊपर बहुत बार क्वेश्चन आ चुका है, इंपॉर्टेंट है. So Montox test is nothing but the diagnostic test for tuberculosis. इसमें क्या है कि tuberculin purified protein जो है वो इंजेक्ट किया जाता है and check किया जाता है whether patient is sensitive to the tuberculosis or not. If it is sensitive, patient will have erythema after 48 to 75 hours after injection. That is a positive test. Now anti-tubercular drugs and their important characteristic, mechanism of action and adverse effect. So our first drug is nothing but the isoniazid. So it is a tuberculocidal. It will kill the tubercle bacteria. It acts on intra and extracellular organism. Mechanism of action, it inhibits the mycolic acid synthesis. Which is the important component of mycobacterium. It is a prodrug. It is activated by prodrug. It is activated inside the body. What is the adverse effect? Serious toxicity, peripheral neuropathy or peripheral neuritis is the adverse effect. So in that condition, you have to use pyridoxine. And seizures and psychosis. Next drug is the rifampicin. So rifampicin. So it is a tuberculocidal antibiotic belonging to rifamycin class. Rifampicin are the other examples. It inhibits the RNA dependent DNA polymerase. It acts on an intra as well as extracellular organism. Only drug effective in the persister form of tubercular bacilli is the rifampicin. So it has hepatotoxicity, flu-like syndrome, nephritis, urine and other secretion. It will color orange colored. The orange colored urine is the adverse effect of rifampicin. Next drug is the pyrazinamide. So again it is a tuberculocidal, kills the intracellular bacteria only, and it is the most active again in the acidic pH. So its mechanism of pyrazinamide is similar to isoniazid. So again it has hepatotoxicity, arthralgia, hyperuricemia as adverse effect. Now next drug is the streptomycin. Again it is a aminoglycoside. effective in the tuberculosis, second line the tuberculocidal, acts on a only extracellular organism. Ototoxicity, nephrotoxicity, neurotoxicity, they are the adverse effect. Ethambutol tuberculostatic, ये साइडल नहीं है, tuberculostatic inhibit the tubercular bacilli in the walls of cavities. इसका adverse effect होता है optic neuritis. So patient is not able to discriminate between red and green color. Optic neuritis इसका peripheral neuritis भी adverse effect होता है. Hepatotoxicity भी adverse effect होता है. Thiazolone is another drug known as tuberculostatic. It has a low efficacy and development of resistance to the other drug. It is used to delay the resistance to develop to other drug. तो इसको combine में use किया जाता है thiazolone. Again hepatotoxic है, adverse effect, dermatitis is the adverse effect. We'll see important points again. Mechanism of action, drug and their adverse effect. So isoniazid inhibit the mycolic acid synthesis. It is a prodrug and it is activated by one enzyme known as catalase peroxidase. So catalase peroxidase activate the isoniazid and that active metabolite inhibit the synthesis of mycolic acid. Its adverse effect क्या है? Hepatitis, which is dependent peripheral neuritis, can be treated by vitamin B6, and again seroblastic anemia, systemic lupus erythematosus. So isoniazid is metabolized by phase second metabolic reaction known as acetylation. Based on the genetic makeup, patients are slow astylatus or rapid astylatus. And in the slow astylatus, it has a more tendency to cause peripheral neuropathy. The patient who are slow astylatus, in those patients it has a more tendency to cause the peripheral neuropathy, right? Now next drug होता है rifampin. तो ये antibiotic है rifamycin. It is antibiotic belonging to category rifamycin. So inhibit the DNA dependent RNA polymerase and inhibit the nucleic acid synthesis of bacteria. Hepatitis, it is an enzyme inducer. It can color your urine orange red. Next drug आता है ethambutol. It inhibits the synthesis of cell wall of bacteria bacilli, tubercular bacilli, by inhibiting the enzyme responsible for the synthesis arabinosyl reductase enzyme, which is important for synthesis of arabinogalactan, which is an important component of cell wall of tubercular bacilli. So cell wall inhibit करेगा ethambutol. It has adverse effect that retrobulbar neuritis or optic neuritis. So dose dependent optic neuritis. Patient can not distinguish red and green color. Next drug होता है pyrazinamide. So it has a hepatitis and hyperuricemia as an adverse effect. Next drug होता है streptomycin. It acts on a protein synthesis. It is a aminoglycosides. It causes deafness, vestibular dysfunction and nephrotoxicity. You can order this magic bullet for GPAT Niper DI Pharmacist exam preparation. Read 2-3 times before exam and qualify 100% with very good rank. You can see we have very much promising results. Thousands of students are placed in the Niper. You can also join our online GPAT Niper 2024-25 crash course. You will have live lectures, recorded lectures, study material, online test series. Lectures will be chapter wise and subject wise. Everything is there in a 8,000, and if you get all India rank below 20 in the GPAT exam, your fees will be returned in the form of reward. Thank you very much.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100